How do you know that your care provider is actually going to support you in having a vaginal birth after cesarean or a vaginal birth after multiple cesareans? Because the truth is that this is a big, big trap that a lot of moms fall into, especially if you're planning a natural birth and a hands-off birth with no interventions, where you get to actually experience physiological birth and not have it heavily controlled. VBAC is a huge deal. It's difficult enough to find someone who is going to let you try. But then on top of that, you're also falling into a lot of other traps. And I'm going to be speaking more about that as we continue this month, possibly even into next month. Cesarean traps are just so big. There's just so many of them. If you think that natural birth is hard to get the first time as a first-time mom, and you fall into the trap and end up having a C-section or an induction, guess what? If you've had a C-section, you have even more working against you in trying to get a natural birth than you think. It's not as simple as saying, I'm just going to go for a VBAC. A lot of moms get this wrong, and they join a lot of VBAC groups and they think this is going to be what helps me get my VBAC. As long as I follow what the doctor suggests, this is going to help me get my VBAC. You don't want to ask your care provider permission. You don't want to do that. You don't want to go to a care provider and ask for permission and get their recommendations as to how you're going to get your VBAC. Because here's the thing, they're not going to actually tell you. You could do this even without them. Even if they were not there, and it's very likely that you could go into labor and your care provider doesn't show up. They're not there yet. This happened to Jenny. She told the nurse to call the doctor, but the nurse didn't believe she was in labor because Jenny would not allow for vaginal exams. So the nurse decided, well, I'm not going to call the doctor until there's a vaginal exam so that I know that I can call the doctor. Even though the doula was like, you can call the doctor, she didn't believe it. So Jenny ended up getting her unassisted vaginal birth after cesarean in the hospital. She was an older mom. She was 41 years old. So way past 35, you know, the danger zone. People like, oh, if you're past 35, you can't really have a vaginal birth after cesarean, or you might be more likely to get a cesarean. No, it's not about that. She also had gestational diabetes. She also had a previous history of postpartum preeclampsia. She had chronic high blood pressure. And she had had a traumatic induction turned into a cesarean with her first baby. She also was group B strep positive. So Jenny had all of this working against her, and she still got her VBAC. How did she do it? By not following the generalized VBAC advice. Because what happens when you do that is you fall into the cesarean traps, which I'm going to be talking about in another video at a different point. But it's basically down to this. Anything that is going to undermine your confidence in your body's natural innate ability and your own innate instincts when it comes to your birth, anything that undermines that confidence in yourself is a trap. Anything that the medical system does that undermines or hijacks the physiological process is a trap. Anything within the birth culture that perpetuates that same narrative and gives you the wrong information that leads you down that path is a trap. So there are so many traps out there, and I cannot possibly list them all in one video. So I don't. I'm going to be building my YouTube channel. You can go and make sure you're sharing, and subscribing to this channel, because I'm going to be sharing more natural birth traps, more cesarean traps, more VBAC traps, all of the things that you might not even realize could be derailing your natural birth or your VBAC or your attempts to avoid an induction. I'm going to be telling you all of that. But first, today we're going to be talking about the big one. VBAC tolerant versus VBAC supportive care providers. Now, there is a lot of lists out there And I will probably share in another video at some point the actual list, but I'm just going to give you a generalization today. VBAC tolerant versus VBAC supportive. You may have heard this language before. You might be in a VBAC group and you might be saying, I'm trying to get a VBAC, but my care provider is saying this, and somebody says, oh, they're not VBAC supportive, they're VBAC tolerant, you need to go somewhere else. But what exactly does that mean? Because oftentimes you hear that language and you're like, well, I hear the doulas talking about this all the time. I hear the midwives talking about this all the time. The birth advocates are talking about this. Moms who have been through this are talking about this. But how do I know for sure? Because did you know that even someone who says that they are VBAC supportive and that they kind of present themselves that way at the beginning of your pregnancy and maybe even to your second trimester, they could still be pulling the wool over your eyes. Because it's not just about what they say, it's about what they practice and what they do. And it's about their overall attitude towards your care. Because they can say, oh yeah, we won't induce you unless we really need to. But then they're going to make up all these excuses as to why they need to induce you or why they need to push you into a repeat C-section. And you won't see this coming until you hit 37 weeks. And then all of a sudden they'll say to you, oh, well, we should probably schedule your C-section just in case so that we at least have it on the books. Trap. It's a trap. Don't do it. Or they'll say to you, you know, your baby seems to be getting a little big. We should probably think about inducing you so that you don't end up in another C-section. Trap. Serious trap. Or they say, you know, if you really want me to be your care provider, I support VBAC, but nobody else in my practice does. So you really need to make sure that you're with me. And to do that, we'll probably need to induce because otherwise I can't guarantee who's going to be on. Trap. If you're in a hospital or they say you need to be in the hospital, we can't do home birth. That's a trap. Like there are so many traps that you can fall into when you're planning a VBAC. If you're planning a vaginal birth after multiple cesareans, this is even more true for you because now you're also going to get a whole bunch of statistics that are going to sound scary about your risk of uterine rupture. Even if they seem to be the most supportive care provider, they still have fears come up, okay? So even if you do get somebody who generally believes in you and wants you to have this, they still have fears come up. Jenny got the perfect care provider for her. He was able to respect her decision to have a VBAC. At the same time, he was still in the medical model. So when they're still in that medical model, they still have those fears come up and they're going to say something that's going to sort of undermine your confidence in the moment or get you thinking, oh, I don't know. Is this person really supportive? And this is where you really need to be careful, okay? Because there could be somebody who's on the surface, they seem good, or there could be somebody who might have some restrictions, but the one who might have those restrictions might be open to actually changing their mind or respecting you anyway, even though they're uncomfortable. And the one who says, oh, I'm totally comfortable with it and I totally support your choice, but then something might come up, some little complication comes up and now they're no longer comfortable and they're trying to control you and they are not open because they have not been able to deal with those fears. That's a completely different ball game. And this is something that a lot of care providers, like, they're not going to tell you because they might not even be aware of this themselves. They might not be aware of that because very few moms will actually come into the practice and challenge them as much as you're going to do. This is what having an empowered birth really is. This is the whole empowered birth system. And like, this is what Jenny did. This is what Rebecca did. This is what Lisa did. This is what I did. This is how we use the empowered birth system, which again, you need to have the right mindset, the right education, the right environment, the right facilitators, and the right support. You need to have all five. Because when your care provider starts to get scared, If you don't have all those other pillars and you're waiting for your care provider to change their mind, they're not going to, because you're not using the rest of the system to keep yourself grounded and calm. You need to be able to stay calm, even when your care provider is saying, well, you know, we just found out you've got gestational diabetes. So normally what we do is we're going to send you to the clinic and you may need to be on insulin and we may need to induce. Well, now you're freaking out because you haven't had the time to relax and take that information in and then think, what's true for me? And this is what Jenny did, is she asked what's true for her. So here is the real thing that you need to pay attention to when you're looking for a VBAC tolerant versus a VBAC supportive care provider. Okay? You want to see how they react to you challenging them. You don't want to see their overall philosophy. This is another thing that a lot of people get wrong, is it's like, oh, you ask them their philosophy or you ask them their rates of success with VBAC. Okay, but if you're wanting a VBAC that's hands-off, that is completely different than having a successful vaginal birth after cesarean. Because you could have a vaginal birth after cesarean and then end up getting the epidural. You could have a vaginal birth after cesarean and have them breaking your waters. You could have a vaginal birth after cesarean, but it turns out to be more traumatic because they're controlling every aspect of it. And then there might be that care provider that said, well, you wanted to go unmedicated, so like you got it, but they're doing things that make your labor more painful, more stressful. And then you think, I kind of wish I'd had a repeat C-section because this was just so traumatic. Sometimes what happens is a mom goes in and she wants to plan a VBAC, but her care provider is so aggressive in how they say how they're going to manage that labor that she goes on and says, you know what, it might be easier if I just schedule a repeat cesarean because I at least have some control there. What she's actually looking for is control over her experience. And when she goes into that care provider and that care provider is now trying to control the experience in their way to make them feel safe, not for their client, when you do that, your ultimate goal here is control. Your ultimate goal is still, you want to have the ability to create your own experience. You want control of that experience. You don't want to be traumatized. You don't want to feel like you've got your power stripped away. But there's a difference between choosing a repeat C-section because you feel empowered and because you feel it's the best choice for you out of all of the other options that are all available to you, versus choosing it because you think that that's the one where you're going to have the most control, because this other thing that they're talking about with how they're going to manage your VBAC, just, it seems too stressful and you don't want to do it. This is why Jenny said, I'm going to have a hands-off VBAC, even though she was high risk. And a lot of moms would be discouraged from that. They would have been told by their care providers, you know, you're high risk, you have high blood pressure, you're 41, you had a previous C-section, you had an induction, you had preeclampsia. Like, we can try for a VBAC, but we need to do it under very heavily monitored conditions. You need to dilate 1 centimeter per hour. We need to keep you on the monitor. We'd like you to deliver by 39 weeks, and like so on and so forth. And then maybe even we don't want your baby to get too big. Now that is the VBAC tolerant model, but it might not have automatically come up until you had a complication. This is the difference. So you go into the beginning of your pregnancy and they say, oh yeah, we won't induce you or anything unless there's a complication. We won't restrict anything unless there's a complication. But then you develop that complication, or you are happening to be in that high risk category, and they say, well, you know, normally we do this, but with you, you are high risk, so we can't do that. Now they're controlling your birth, and now they've become VBAC tolerant. They may not have originally been VBAC tolerant, but because of your unique situation, see, this is your unique situation coming into play, now they're VBAC tolerant. Or maybe you don't have any complications, but this is your second attempt at having a VBAC. The first time it didn't work. Second time you got tricked. Third time you're determined to do this, and your care provider is like, well, you know, but with multiple cesareans, it's more risky. So we really would prefer if you were on the monitor at least for 20 minutes. No. Now they're back to their fear again. Because if something comes up that's even just like slightly off, or you're not following their pattern of how they think labor needs to go for you, remember the labor traps, that's when your birth gets derailed. Now, a lot of moms, that are really, really determined and like, I am going to have this vaginal birth after cesarean and nobody's going to touch me. And I'm just going to stay home and do it. And I'm going to do it myself. Like, you can do that. However, Jenny, even though she wanted an unassisted birth, she knew that that wasn't going to be what she needed. It wasn't the best thing for her. It wasn't what she needed. She knew that she wanted to monitor her blood pressure, and she knew she couldn't do that at home. So for Jenny, she felt like, I'm going to labor at home as long as possible. And then I'm going to go to the hospital because I do want to have that backup medical care. I don't need it, but I want to have it in the background so that if I need to call it in, it's there for me and it's right there. And this is the thing that a lot of childbirth educators, they don't touch on this. It's like, either your home birth, stay home and don't go into the hospital, don't give into interventions, don't do this, and you'll have your natural birth. No. If you want a natural birth and you want it in the hospital, that is a possibility. However, again, you need the 5 pillars of empowerment. You need the right mindset. You need the right education. You need the right environment. You need the right facilitators, and you need the right support. And when you have all 5 optimized, what happens is that then you can stay grounded in your power, and you can be like, I can do this. I can birth my baby, even if I'm on the side of the road. I'd prefer to be in the hospital for this. However, if it happens on the side of the road, I'll be okay. Or I'm going to birth my baby at home. But if at any point I feel I need to transfer, that doesn't mean I give up my whole birth plan. I still can advocate for what I want and get it. I still have my team. I still have my mindset strong. So even if the nurse is freaking out and telling me that she needs to check me in order to know when to call the doctor, I can just calmly do my thing and be like, fine, you're not going to call the doctor. I'll birth this baby myself. And then I'll show you that I really am in labor. I really am that close. And you just dropped the ball, because that's on them. That's not on you. And honestly, this is my own personal dream, is that if we had more unassisted births inside the hospital environment, that would allow the medical system to start witnessing that birth does work. Because right now what we have is we have a heavily controlled system where even if you're asking for a natural birth and you're going to the hospital, they've never seen a physiological birth in their life. They don't know what it looks like. So they are scared because all they see is disaster. Why do they see this disaster happening all the time? Because they're controlling the physiological process. And anyone who doesn't follow that textbook pattern gets Pitocin, gets induced, gets more vaginal exams, gets their waters broken, gets a C-section. And they say, well, you know, birth is just dangerous. Like, so much can go wrong. No, it's not that birth goes wrong. Birth rarely goes wrong at home. Very rarely does it happen that you have an emergency. And oftentimes that's because it wasn't planned. You were planning to go to the hospital. You had a complication, but your labor started too fast and you had a home birth. But they just take all of those studies and they lump them all together. And then that's how they get their rates. They don't just study the moms who are planning home births and actually had the education. There's so many variables. You can even be planning a home birth, but not have very much education, not have the right midwife to attend you. And then it all falls apart. Maybe you don't have the doula support. A lot of hospital birth transfers from home also happen mostly because you want pain medication. That's it. It's often pain medication, but nobody says that. Nobody says that. They just say, oh, well, the hospital transfer rate is this. So the chances of you actually having a home birth, especially as a first-time mom or as a VBAC mom, is very, very slim. So you should probably just be in the hospital. And then the idea is that if you are going to have this very minimum chance of doing it. You might as well just be in the hospital in the first place. Or if they say that your chance of VBAC success is very low because they're using that calculator on you, throw out that calculator, by the way. Don't ever trust anybody who tells you that they're going to use the VBAC calculator to figure out if you can have a VBAC. The only way to tell if you can have a VBAC and your body works is if you go through a physiological process and then it results with you having your baby. Note how I said physiological. I did not say controlled VBAC. If they're controlling you and they're inducing you, breaking your waters, trying to make your labor go faster with Pitocin, all of that can contribute to a repeat C-section. Or if they're scaring you in the last few months of pregnancy and they talk you into scheduling your C-section, and now you're trying to go into labor before your C-section. So now you're also trying to do all the things to naturally induce, and there's no such thing as natural induction, by the way, because the idea of induction is forcing your baby out before they're ready. Guess what? That is not the same thing as proving that your body works. So even if you attempted a VBAC before, if you fell into any of these traps, and there's so many of them, and I'm going to keep touching on them, like if you start to think, wait a minute, but this happened and that interfered with my labor process, so maybe I can actually have a VBAC. Maybe it's not my body that was broken. Maybe I fell into a trap. Now we're talking. Now you are more likely to be able to get it. And this is what happened with Rebecca, is that she went through one of my trainings. I talked about physiological birth and I talked about how her body actually works. And she's like, that's what I want. I want to prove that my body can do it. I want to actually birth and experience birth in a physiological way. How do I do that? And I showed her how to do that. And we worked together for 3 months. And then in the end, she chose to have an unassisted vaginal birth at home after 2 cesareans. But that was her choice because she had always wanted a home birth. She had decided, you know what, I want a home birth, and I thought I couldn't get one. But now that I know that I can go to the hospital, it's 5 minutes away, if I feel that I need to change my mind, I feel powerful enough that I can have this home birth. Now that I know that I could call somebody to the house if I really needed them, I feel comfortable having this home birth. And she had her beautiful home birth after 2 cesareans with her partner catching the baby. And then afterwards, she was just chilling out on her bed and she was eating like lunch and stuff. And she was just like happy. She's like, man, like I feel great. And I said, now remember, even though you're not recovering from major abdominal surgery this time, you still got to rest. Like this is postpartum. Like you still got to rest. I know you feel like you could like run a marathon at this point because like you just did this amazing thing, but now your body still needs to recover. And like, it was really hard for her to get that rest. Like I had to keep reminding her as her coach and as her doula to get that rest. And that's what happens when you have a physiological VBAC, is that you suddenly realize like, wow, look what I just did. Look what my body is capable of. Like they said that I couldn't do it. They said that I was broken until proven capable, or they didn't say it, but they implied it with their language or the way that they were treating me in my care and their fears that kept coming up every time I pushed them. But no, I did it. So that's what the whole empowered birth system does. And again, you can go and get that book. It's complimentary. It's on my website. You just go to empoweringmomsbirth.com/book. Once you sign up for that book, you will also be taken to a 1-hour masterclass. It will just automatically be up there on the page. Your book will come to your inbox so you can read through that, or you can watch the class first, and it will give you the overview of the entire empowered birth system, what you need to do, how to get that right mindset, what you need to do to get that right education, including some crash course education on physiological birth, where to get that right environment, what to look for, how to get that right facilitator, how to get that right support. And it's interspersed with actual stories of Rebecca, Lisa, and Jenny, who went through this empowered birth system and they got what they wanted or close to it. Lisa, of course, was derailed because she didn't have the right support in her family. However, if they hadn't been home the day that she went into labor, if she had just been by herself, that baby would have been born on her bed. What happened is that her family came in and scared her and stressed her out. And remember, when you're stressed out, your body says there's a tiger in the area, we can't birth, so everything shut down. Everything stopped. And then that's when they took her to the hospital and they gave her the C-section that she didn't want. She didn't want it, but of course they forced her into it. But even as Lisa was watching this play out, she could see just what was going on. She had her eyes opened, and that's also what the empowered birth system does. It opens your eyes. You can start to see the traps. So I can list them all day long. I can give you that education, but until you actually see it, it just doesn't work. It goes in one ear and out the other, because I've watched this. I've watched this with moms. I gave so much information. And I myself, as a first-time mom even, I had poured over information to try to get myself to see that my son might actually be growing fine and I could have a home birth. Like, I had that information. If I go back and look at all the stuff that I read, it was right there saying you can have a home birth. In fact, my doula sent me a lot of it because she was hoping that I would come to that realization, but I didn't. I didn't come to it until after. And the reason why is because when you are so indoctrinated into the medical system, as we all are indoctrinated into the system. It's immersed in our entire culture. It's in our education. It's everywhere. Our early education. And when you have new information that contradicts everything else around you that you have been taught to believe, it doesn't work. So I can give you all of the information all day long. And that's what I do in the YouTube channel, is I give you the right education. But until you have the whole system, until you understand how it all works together, because these all tie into each other, and your empowered birth will tell you how it ties into it. And again, you can get that at empoweringmomsbirth.com/book. And you'll get that, and you'll get the masterclass, and you'll understand how birth actually works, what you need to avoid, what you need to do differently than what a lot of childbirth education tells you to do, or what your doctor will tell you to do, or what your friends and family and the mom groups will tell you to do to get that natural birth. Even if you're older, even if you're of a higher or lower body mass index than what's normal, because normal is not actually a thing. Even if you don't go into labor by 40 weeks, even if you're a 42 or 43 week mama and you just you won't go into labor before that arbitrary timeline, and you know that there's going to be that stress, even though you know your own body and you say, no, I'm a 42 week mama, having that stress of people around you saying, yes, but you shouldn't be. Your body is somehow defective, and we can't allow that. Even though, yes, that's your normal, it's not normal for us. So we're scared. So we're going to try to control it and try to make you fit into this box. That's basically what they do, is they're trying to make you fit into a box, and the box doesn't exist. The box was made up. The box was made up by men who didn't understand how our bodies work, but thought, you know what, let's just control this process, because we can just put mothers into the hospital. And if they don't follow this system that we made up, we can just speed everything up and we can make it more efficient. And then that way we're rah, we're heroes. Yeah, no. The reason they had the smear campaign against midwives was because they didn't want the midwives to say, you know, your body's actually normal. No, it's witchcraft, right? It's witchcraft. We can't do that. Itchy. So that's my little talk today. I will get into cesarean traps and VBAC traps at a later point, but I just wanted to clear up about what's the difference between VBAC tolerant and VBAC supportive, and that little missing piece that a lot of people don't talk about, which is that You might see that this care provider looks good on paper and they seem to check all of those VBAC supportive boxes, but the second you deviate, how are they responding? Or the second you decide to call the shots and say, you know what, I get it. I get that I'm older, but I'm not going to induce. How are they going to react? When you start challenging them and asking the questions that are inside of your Empowered Birth, and also how to hire your care provider, which is another book you can get at my website on my shop, that will help you to see those traps coming before it's too late. Because oftentimes you don't know you're in a trap until you're 39 weeks or 40 weeks or 41 weeks, and it feels like it's too late. But I've been in this for about 10 years now, and I can see those traps coming months ahead of time. The second you start telling me what your care provider is doing or how they're talking to you, I can kind of start to see where that's going, and I can get you back on track. So again, go get my book, Your Empowered Birth. It's on my website, empoweringmomsbirth.com/book. All right, talk to you soon.